as the things are settling down, he will initiate it and then the progression will happen. Please.
That I found over a period of time that sometimes I had to learn the hard way, stumbling along the way. And hopefully, if time permits, we'll see a couple of examples at the end. And the suspension suture, all that I mentioned earlier, in one single hole, and that is him. Of course, I was lost. And I'm glad to say, 18 years later, this guy is still alive and he sends his flowers and sweets. 18 years. This guy was told, please go home and die.
So that is where I had the idea of thinking that, maybe in the perforator flaps, there are multiple layers that could be safe. And in the beginning, we were taught that, there's only subfascial and suprafascial, and this is based on the deep fascia. Those are the two only layers that we could elevate. However, if you consider the facts, and also in obese patients, we go again higher and do it in the ultra thin layer. And the same principle applies.
When you apply collagen, the membrane should remain like this, transparent. That gives a antibiotic most sensitive is cefotaxime. So the next month, when you are planning for the antibiotic thing,
the time that silver sulfadizine came into market, every other person started using silver sulfadizine. The parents think that they will have to do something very good. Minimal ointments permit normal biological healing because face has got wonderful capacity to heal by itself. Early skin grafting of the raw area. A good neck contracture release is sine qua non.
Team A, please start. Introduce yourself very fast.
Good morning. I'm Devyalakshmi from CMC Vellore.
Yeah. Fast.
Good morning all. This is Dr. Manimegla from Madras Medical College.
Soundarya from Madurai Medical College.
Ucha, louder.
Soundarya from Madurai Medical College.
Louder.
Good morning. I'm CP Mohan from Madras Medical College.
I'm Lisa from Madras Medical College.
I'm Dr. Krishnamurthy from Madurai Medical College.
I'm Dr. Preetika from Stanley Medical College.
I'm Dr. Lakshmi from Madras Medical College.
Okay. Yeah, 10, 9,
laser,
8.
hair.
Yeah, somewhere. Tell us, you're right.
Laser epilation, something.
I can give you some more time, you're somewhere closer. And
the topper of the quiz is Team A with 95 marks. This is Divya Lakshmi with Manimegala.
This is the much awaited junior postgraduate prize paper session. So I invite our moderators, Dr. Roshni Gopinathan, Dr. Ashok Swaminathan, and Dr. Selva Sitaraman.
So mandible is the second most commonly fractured facial bone, common cause being the road traffic accident, and usually it is associated with other injuries such as traumatic brain injury, chest injury and extremity injuries. Traumatic brain injury usually results from external mechanical force.
So for this purpose, two commonly used dressings are nanocrystalline silver and collagen. Certain factors are always taken into consideration before choosing either of the two. First, it should promote wound healing, it should have a decent safety profile, and it should be easy to use.
So results, incidence of post-bone contractures was higher in the age group between 21 and 30 years, with the median age was 26.6 years, and the male preponderance of about 60%, with the mean distance from hospitals was around 60 kilometers, with the mean etiological of burns with the...
So, coming to data collected, we collected about for the patient demographics, preoperative degree of flexion contracture and operative range of motion, and postoperative range of motion and degree of flexion contractures, and the surgery procedures performed, and follow-up assessments at 1 month, and third month, and final assessment at 6 months.
Hence, here we use the occipital artery perforator based flaps in both these scenarios because it's a microvascular surgery minus microvascular anastomosis, the robust homogeneous blood supply because of the sympathectomy while raising the flap, no donor side deformity.
Associated not only with the digital neurovascular bundle and the soft tissues at that level, but it exceeds further. So we have always to examine the amputated part under the microscope, first to look for the area of good quality vessels and nerve. But
One such novel method is the use of platelet-rich plasma in the treatment of burns. Hence, as a pilot study, I wanted to try the use of PRP in our population with burn injury. In this study, we share our experience using the platelet-rich plasma in the treatment of second-degree burns.
About 44% patients fall under 21 to 30 years of age group, and about 52% of cases involved in country-made crackers, which is made in the nearby villages. It's a locally made crackers. Regarding the cracker composition, a regular cracker contains charcoal.
Trophic ulcers in diabetic foot occurs due to sensory or motor or autonomous loss of a nerve function. In patients with diabetic peripheral neuropathy, the protective pain perception is absent, hence the patient. So reconstruction is slightly difficult because we need to restore the defect with cosmetically similar, functional and a sensate tissue. So the goals will be maintenance of the oral competence, providing sufficient oral access and providing lip sensation.
Aim to evaluate the safe and reliable harvest of PAEA fasciocutaneous flap based on the connection between PAEA proper and interosseous recurrent artery.
We stabilized him and he taken for the penile replant along with the urology team simultaneously, and urology started with the proximal urethral dissection where we had
for a complex defect, anterolateral thigh-free flap was done. So all flaps they survived, and the minimal SSG loss alone was noted only in the peroneus brevis muscle flap patient, which was managed conservatively.
Or vascularized autograft. So mainly we used like Kapana or Ebikamana, but some conventionally it was used like single stand of.
Reconstruction is the form of establishing the conduit continuity in the laryngopharyngoesophageal cases in a post-oncological excision defect, and then salvage procedure as correct.
We did a preliminary cadaveric study, and this was conducted to define the origin and course of the Erill's branch of superficial temporal vessel. We studied the superficial.
Whenever the patient had tendinoculus injury, we repaired the tendinoculus also along with the flap. So all the flaps healed well with good tendinoculus result.
But the meatus is placed at the tip of the glans penis. So this is one end of spectrum of CODI without hypospadias. So these patients have difficulty and they have painful erection and difficulty.
We started her on routine antibiotics and sent a wound swab. On day 2, we have done a debridement, and we had a strong suspicion of fungal infection. So even sent tissue for the.
Following, he has been presented to us after 2 days from the periphery to our institution. On examination, the hand was extremely contaminated with multiple
and then facial-maxillary and nasal injuries are common among the RTS. In our case, it's an isolated nose injury, and no other regions are involved, which is caused by an bulgur, that is during a jallikattu sport.
It is a relatively common but potentially devastating manifestation of type 1. It is managed surgically and it's a mainstay of therapy, but in the head end region, it is limited.
For which preoperatively we have done the marking of posterior labral anteperforated flap. Marking was done, and based on that, length of 11 centimeters and width of 3 centimeters, we have designed.
Undergoes repeated trauma that leads to skin breakdown and ulceration.
We are in for an interesting session. This is the first time this is being introduced in TANPAPS conference. This session is called Just a Minute session. I think many of us would have gone through this in.
Next, I elevate the flap as needed to the defect. Donocytes can be caused primarily. A few illustrative cases where the skip is useful. How big a flap you can elevate? Big enough to cover the dorsum of an entire foot, yet you can close the donocytes.
Here is a 45-year-old male gentleman, alleged history of RTA, complaints of double vision, redness in eye. On examination, there is a diplopia and upward gaze, tenderness in infraorbital rim, subconjunctival hemorrhage in right eye, and ophthalmos. On investigation, X-ray skeleton and axial view of CT scan.
Fasciotomy was done. Lost the left limb, right limb, bone deep burn in the arm and viable hand. Debrided the elbow flexors, the musculocutaneous and the median nerve. Only the vessels pad, PMMC flap was done.
So in this case, you can see I have inserted. I have first marked the facial artery and inserted the needle, and with the help of the tip of the needle, I have marked the fem flap, raising the.
Allograft was debrided and autografted. The partial thickness burns healed spontaneously under the allograft, and autografted areas settled well. The challenges escalated with electric burns to scalp, causing exposure of the calvarium, which was covered with scalp rotation flap.
He came to India because there was a retained bullet in the neck and it was removed.
and he had 10 days to go back to his place, and he just consulted whether there is any possibility of facial contour impairment, and he was totally against having any other prosthesis.
Unable to bear the sufferings of her son, mother left the village and brought to us. On evaluation, though pathologically is a benign tumor, clinical evidence of rapidly progressive irregular mass and restriction of movement, and MRI evidence of tumor encasement of second, third metacarpal bone, tumor board decided to go for wide local.
But what happens when you combine the two? There is a good amount of literature evidence to say there is a good size reduction and reduced recurrence rate when you combine the two, and the ADR profile is also better. This is a case example, a post-acne keloid, complete remission achieved in 5 sightings over a period of 5 months.
And then columnar stat is prepared. Sometimes anchoring of septum to ANS is done, and the medial crural and the columnar stat is anchored. Then the transdermal stitch is taken, and the interdermal stitch is taken.
So the pre-op assessment video which showed normal movement, normal range of motion in the shoulder, elbow, wrist and the fingers. He underwent left brachial plexus exploration with wide excision of tumor, incision marking the dissection of the tumor, and the tumor was...
We found the dorsal 2, the black arrow marks are the digital nerves, distal 2 digital nerves to the thumb. This tempted us to explore for the proximal segment. We traced the ulna.
It presents as breast asymmetry, ptosis, nipple descent and enlargement. We need to operate for correction of severe asymmetry and functional problem. Reduction mammoplasty proceeded. It gives improved
supraangular incision which is closed primarily. Here we have a small defect which has, where you can see the preperitoneal fat herediating plus exposed main vessels. I have taken the region of ALT and adipofacial flap under with a little bit laryngeus lateralis muscle.
With hypertrophic scar, after scar excision and deformity correction with the central slip tendon repair, a non-dilating incision was made and the perforator was visualized after the tourniquet release and flap was transposed. This is the post-operative and video showing the good hand.
It was a challenging task for us to handle this boy who had multiple scars in both the upper limbs.
This child underwent more than 7 surgeries. Now the child is completely recovered from the illness.
An audio, it has to be spoken in the podium, and it has got to be a verbal diarrhea. It has got to be a verbal diarrhea, no hesitation, no repetition and no deviation. I think these 3 things have to be kept in mind when you are making a jam. So
the second prize is shared by 2 people. I don't know whether you like that. By Dr. Rajendran and Dr. Subhashini. முதல் பரிசு ஒருமனதாக தேர்ந்தெடுக்கப்பட்டிருக்கிறது. டாக்டர் பவித்ரா அவர்கள்.
And you all know amputation at this level, the function of the thumb decreases nearly by 100%. And you all know the options, non-microsurgical and microsurgical. And microsurgical, we have all these: great toe transfer, second toe transfer, wraparound technique, trim toe technique, and twisted toe technique and its modifications.
My learned colleague gave a wonderful lecture, but he has forgotten one thing, 2 points actually. He said that it was a microsurgical reconstruction, but I noted in his toe transfers he had done a groin flap earlier and he had to excise all that in the later stage. So he has used a non-microsurgical technique also in that.
Obviously, it has been a very tough arguments on both the sides. And as you all know, these 2 are pioneers in hand surgery. Both of them brought out their points exceedingly well. And I feel I agree with Wong, where I think that both has a role to play.
What do you say about this case? All skin flaps are avulsed, muscles are all lost. What local flap are you planning to do in this case? We don't have any answers and the bone is shattered. And eventually we are sure that this patient will have non-union at some point of time. So you need to do something like a fibula or something like that to reconstruct the bone.
Showed lot of fancy cases and complex cases. In real situation, it's not the real one, because the most of the defects are simple, medium and moderate size defects. The percentage of this
decision to make, and I know now I understand why you asked me to do this panel. Because if I choose one side, then I know that person's never going to speak to me again. But I think, again, you know, it's very evident and clear to me that both options, local flap or free flap, we all need to understand.
Without the discipline, the dream remains as the dream. Who told this? Who told this? The famous Dr. APJ Abdul Kalam. The discipline is the architect of success. If you have the discipline, the A to Z of all the advantages of the traditional teaching will automatically come to your feet.
How many of you noticed Rashida madam's first slide? It was that of Dronacharya. And the traditional failure, teaching oda failure model model Dronacharya da. Our fail anandal da first online student Ekalavya vanda. If Dronacharya had been a teacher, great teacher, had been the ideal teacher, he would not have had favoritism. He would not have had an Ekalavya. That is the first fallacy of traditional teaching.
I'm suddenly remembering my school days where a question seems like a trick question. This is a trick debate because I do believe it's a complement of online and offline learning. But what is really true is that we are seeing more online contents invade our space.
Learning from a person or professor is that interacting with him is very, very important. You not only imbibe plastic surgery, you imbibe so many other things from that professor. And ours is a surgical specialty. The way in which your professor holds the instrument, the way in which he puts the knot, everything is important.
So what you have seen over the last 2.5 days is the culmination of work which we have done over the last, I would say, 3 months mainly.
And I hope this conference, you all enjoyed this conference.
The wonderful trade show that you had, I mean, it was a record of sorts. It all happened because of one person. You all know who that person is. Sita, I call him Sita, Dr. Selva Sitaraman. He was the, I mean, he's such a smooth talker. If you gave him another extra half an hour, he would sell this hotel to one of you.
Wherever I get problems, he just came there and did the needful. And I think it's just the result of good coordination between all of us. Nothing individual, it's the teamwork. Thank you so much for the opportunity.
All this organization, the hotel, the transport, and all this audiovisual, all this was organized by one person, Dr. Jayakumar. Getting Professor Hong here, we had a wonderful time interacting with you, and the one person responsible for this was Skanda.
Sir, it's a pleasure to be part of this, and I'm so glad that Professor Hong accepted our invitation. It's a privilege to be a part of this. Thank you. We'll do it again sometime.
Subhashini, she ended up with a wonderful, perfect book.
Thankful for getting the opportunity for editing the book. I didn't know anything and I underestimated the time needed for editing book very grossly.
And in TANPAPS, have you ever heard whistle sounds going on? It happened in this TANPAPS. It was all possible due to one person, Dr. Prema.
But everything is his brainchild. I am just an executor. Thank you very much for giving us this opportunity, sir.
Prize for the junior consultant category, Professor R. Venkataswamy Prize. This is called Professor R. Venkataswamy Prize. The first prize goes to Dr. Sangamitra. Many congratulations. Professor K. Matanki Ramakrishnan Award for the best publication for the last year goes to Dr. Abhirami Chellamuthu. I hope she is here. Yeah. Many congratulations, Doctor. There are 3 authors. We have invited the corresponding author alone. The others will also be in the list. Professor Sam C. Bose Award. This goes for the quiz. The team that won the quiz, there are 2 per team. The first prize goes to Dr. Divya Lakshmi and Dr. Mani Meghala. The team comprising of Dr. Divya Lakshmi and Dr. Mani Many congratulations, Doctor. Winner of the residence, Professor C.R. Sundarajan Award. This goes to Dr. Salim. Many congratulations. His presentation. Yeah, I think we are. Yeah, anybody from Madurai? Yeah, Dr. Prema. Now we have a award for the best posters. At this moment, I would like to thank all the judges who had judged these competitions and made our life very easy. So all we had to do was just announce. Thank you very much, all the judges of all the categories. Thank you very much. So the first prize goes to Dr. Guduru Pavan Kumar. He is available. MMC, any representative from Madras Medical College? Mohan, please come. This award is named under Professor U.S. Naik Poster Award.
So, when GK sir started the work last year, 6 months back, daily we will give a list I have to complete. For the past 3 months, morning 9 o'clock and 4 o'clock, you will be sitting there. Once again, it's a honor and privilege. GK sir, he gets up at morning 3 o'clock every day. He's such a dedicated and...
This C5, C6 injury, which is an upper plexus, is not same as 5, 6, 7 or 5, 6, 7, 8. The main difference is, somebody can click on to that, this one, please, the video, it's a video.
I think the take home message for, especially for the PGs, clinical examination is the most important thing in brachial plexus examination, more than MRI or nerve conduction study, so that should be very good. Thank you.
As you all know that fingertip amputation is one of the commonest mode of injury you will see in the emergency department. So irrespective of the level of amputation, replantation is the best form of reconstruction. It not only restores the form and function but also...
So constriction band syndrome, it has many names, starting from amniotic band syndrome to n number of names is there. It was first, it's defined as a formation of a constrictive bands in utero by the fibrotic tissues, which was first described by Montgomery in 1832.
Characterized by its abundant vasculature and high concentration of nerve endings, is crucial in facilitating intricate daily activities requiring coordination between the brain and upper extremity. The neurovascular integrity of the digital pulp is of paramount.
So we start by tattooing the perforators. This tattooing, we prefer tattooing by passing the needle parallel to the dermis to avoid injury to the perforators. And it also helps us during intraoperative dissection of the perforators. So we follow the
brachial plexus injury is most debilitating in nature, and restoration of elbow function is a significant goal. Out of the options available, double transfer, that is Oberlin technique, and intercostal nerve transfer are one of the options that gives.
Soft tissue foreign bodies are wounds associated with foreign bodies caused by blunt, abrasive or penetrating injuries.
The patients usually present early or late with a plethora of symptoms and signs. Usually the foreign bodies can be divided into 3 groups according to their composition.
The fractures of closed proximal filings with metacarpal were around 30 patients. Metacarpal fractures were 23 included and proximal filings were 22 that were included in the study, done in Chengalpet Government Medical College, and the standard protocol of patient selection and written consent was obtained.
And here it's a retrospective observational study where it was done for the past 1 year, and all accidental bite change pocket injuries are taken into consideration of all ages, and exclusion criteria.
The materials used to provide the rigid support for the chest wall are polyethylene. No, sir, vasopressors are mainly used by the anesthetist. Perioperatively, when we are raising 2 flaps, there is going to be hemodynamic instability.
These are about 5 patients in 7 years. 4 are male, 1 is female. 4 patients more than 75% burns managed conservatively, 1 more than 60%.
So if we are able to propose an index based on these liver function tests, it will be acting as a useful tool and it will be a guide for a treatment protocol. It can also improve the survival during our treatment.
The aim is to compare morbidity in patients who are managed by early excision grafting within 7 days of burns and who are conservatively managed with respect to length of stay, number of surgeries.
Details and methods. A retrospective study was conducted in patients admitted with cracker burst injuries in the Department of Plastic Surgery in Tanjore Medical College between December 22 and 23, excluding the festival seasons.
Inclusion criteria: the wound defect in the hand and forearm exposing vital structure for which local regional flap were not feasible. Patient willing to undergo the flap surgery.
In covering the compound defects of the distal third of leg and ankle, it possesses a quite challenge due to the limited elasticity and thin soft tissue. So we need a
with who presented to us with the growth over both eyelids on the left and the left side of both the upper and the lower eyelids, obscuring her vision for over a year.
The biomechanics of foot is the stance phase and the swing phase. That is, pressure from the heel to toe is measured in the pedobaro